Like all things in life, it's important to have the correct framework when confronted with a problem. That said, I work in a men's health clinic several days a week, and I am confronted with a lot of the same questions on a day-to-day basis. And I wanted to take a moment to dispel some of the myths around erectile dysfunction and the medications used to treat those. I'm going to give you about 5 or 6 thoughts on this, and we'll just kind of cover these as they come up. But the first one is that ED is a normal part of aging. While statistics show, at least in this country, that the likelihood of having some problems with erectile dysfunction increases dramatically with age, it's not universal. I have many men who are maybe low on the testosterone spectrum of things, but do not have any issues with ED at all, or they have other issues I'm seeing them for, maybe sports medicine related, and they're in their 60s or 70s and have no problem whatsoever with sexual function. Keep in mind that this can be a canary in the coal mine, if you will. There are other things that can contribute to this, whether it's cardiovascular disease, cholesterol problems, hormone imbalance, performance anxiety, diabetes obviously is a huge one, stress, poor sleep, all these can be factors. Sleep apnea is obviously being diagnosed more frequently. All these things can contribute, so don't take it as factual that all men suffer from this problem. It is more common than you think, but it is not universal across the board. The next point is that the medications that we use to treat this condition do not work instantaneously. A lot of people are under the impression that when they pop the pill, 15 minutes later, they're going to have a full-sail erection, and that's not generally how these medications work. Like anything, it needs to be absorbed through the body. Some can be taken with food, some must be taken on an empty stomach. There are some preparations that are chewed or used under the tongue. These can result in more rapid absorption, but I've had a fair number of patients with some pretty intense side effects from that preparation, so be sure to discuss this fully with whoever you're consulting about this problem and what medication may be right for you. The medications by themselves do not cause spontaneous erections. I have many men that are concerned about taking the medication and then walking around for 4 hours with an erection. That's not how the medications work. They're designed to augment what the body does naturally. That being said, to increase blood flow to help get and maintain an erection still requires the physical aspect of it, the mental aspect of it. So it's a complex process that involves several parts of the nervous system, but they do not by themselves create spontaneous erections. Some people think that this is purely a physical problem. It can be in some, but a lot of times there are other factors involved. There can be a subconscious loop like performance anxiety or stress about whether or not it's going to happen again with this particular encounter, lifestyle changes, new partners, job-related stress. There are a whole host of other things that can go along with erectile dysfunction. Also, the other point is that erectile dysfunction medications can and do have side effects. Fortunately, the serious side effects are relatively rare if you read the manufacturer included information in the prescription that your provider gives you, but some of the side effects can be quite serious, can cause vision loss, hearing loss. There are certainly health conditions that are contraindications to using these medications, and having a clear understanding is critical. Don't hold back on sharing information with your provider. Don't leave out medications or over-the-counter supplements, because the interactions can be quite drastic. Unfortunately, I've had a few patients that have come up with their own mechanism and methods of taking a variety of substances and supplements on top of prescription medications, not only in the men's health realm, but also in the emergency department where I've worked for about 20 years, and the side effects and end result can be quite drastic and catastrophic. The final point, just to hammer home, is a condition called priapism. Some men are under the impression that these medications are going to bring them back to their so-called glory days of their teenage years, and the reality is that priapism can and does occur. It's fortunately fairly rare. I've seen it a handful of times in the emergency department. Sometimes it's from injections, sometimes it's from coexisting medical conditions. Sometimes illicit substance use can cause this, such as like methamphetamines, and the treatments can be a little bit unpleasant, including needles and drainage, and in rare cases surgery to put in shunts. I've had a few patients that have gone off to the operating room to deal with this under the care of a local urologist. So follow the advice given by your provider, read the package insert that comes with it, pay attention to what the pharmacist tells you, and I hope you found this helpful. I just wanted to share a few common myths regarding erectile dysfunction and the medications used to treat this condition.